So maybe you've heard about the coronavirus. It's a fast-spreading virus that originated in China and unfortunately is proving deadly for some humans. But the big question is, what exactly is it? Overall, there are hundreds of strains of coronavirus around the world. Most of these infect animals. For most of us, most of the time, it's just cold-like symptoms. There are 7 infect humans, but nowadays we've had 3 separate viruses that are causing more problems: SARS, MERS, and this new coronavirus. One of the big issues with coronavirus is the symptoms start out just like flu symptoms. You start out with a fever, a cough, runny nose, don't feel very well. With coronavirus, since it's a respiratory virus, it tends to settle in the lungs and people start getting shortness of breath. That's the telltale sign, along with exposure in Wuhan, China, or exposure to somebody who's been in Wuhan, China. So the coronavirus spreads like any type of cold or flu-type virus by people coughing or sneezing and you coming into contact with those particulates, those things that come out of their mouth and nose. So if you're touching a surface they just coughed or sneezed on, especially if it's been the last 15 or 20 minutes, and then touch your nose, your mouth, or your eyes, you can get the virus. If you're within 3 to 6 feet of them and they cough or sneeze and it gets into your face, you can get the virus as well. There is no treatment for coronavirus. We have no medication. We have no vaccine that will treat it. So right now it's what we call supportive care. You're treating them respiratory-wise, meaning you're keeping them on oxygen, keeping them breathing, IV therapy to keep them from dehydrating, and then letting their body recover. SARS and MERS both proved deadly to humans. With the SARS epidemic in 2002 and 2003, over 700 people died around the world because of it. The big challenge for doctors back in 2002 and 2003 for the SARS epidemic was first and foremost lack of information. It took months for China to open up and say, hey, we're having a problem here. So the Chinese and the world learned a lot of lessons from the coronavirus SARS outbreak in 2002 and 2003. Lesson number 1, jump on it very quickly. Be very open and transparent about what's going on. Right now, they're quarantining these cities to try and prevent the spread, and that means limiting transportation, shutting down these markets, and making sure that it doesn't spread. Unfortunately, it has gotten to other parts of the world, but these other nations are doing what they can as well to try and prevent it from spreading, and the World Health Organization just declared a public health emergency to help them all get resources and the material they need in order to stop this from getting worse than it is already. So there have been many epidemics over the last 20 years. The last epidemic you probably remember is Ebola. Here's the big difference between the two. Ebola is very hard to get, but once you get it, it can be very deadly. Coronavirus is easier to get, but it's not proving quite as deadly as that virus. And so again, looking at the two of them, they can both be very scary, but they're scary for different reasons. A lot of us are worried about the coronavirus. Don't think twice about the flu, but the flu is a bigger killer. Last year, 2018, 2019, there were 34,200 deaths just from the flu estimated here in the United States. Compare that to coronavirus, where it's been a couple hundred deaths around the world to date. And so again, put your emphasis on the flu. A lot of experts are saying, myself included, go ahead and get the vaccine. It's not too late for that. That can protect you from the flu and protect you from getting sick from other things as well, because your immune system will be as strong as it can. So right now they're rapidly trying to develop a vaccine, but this is not something that's going to happen overnight. They think that's going to take about 3 months. Then they're going to start testing it in humans. Those clinical trials will take about another 3 months, and then they have to start production. So they estimate within about a year we should have a vaccine. So both the World Health Organization and the CDC have emphasized the fact that public awareness is the biggest tool they have to try and prevent the spread. If you are having symptoms and you were exposed to it in Wuhan, China, or exposed to somebody who was over there and is showing symptoms, call ahead before you go into your doctor or the hospital, because they want to make sure that they can isolate you before you get in there, which will help stop the spread. That public information is the one tool that's going to help get this epidemic under control. A lot of people right now are worrying about face masks and if they need to wear one. Face masks, especially the rectangular surgeon-type face masks, were made to prevent the surgeon or other people in a healthcare situation from giving germs to a patient. They weren't made to protect the person wearing it. So first and foremost, it's not going to protect the virus from coming into your body, but it will protect you if you're coughing or sneezing from getting those particulates to somebody else. The best thing you can do if you're worried about this is simply wash your hands 20 seconds or more, cover up when you cough and sneeze, and be aware of what's going on. Listen to your public health authorities and news sources to see what's happening with the virus.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.